This is Dr. Patrick Hu from Moffitt Cancer Center, coming to you from Chicago, Illinois. We're at the ASCO annual meeting. We have the pleasure of being with Dr. Ibrahim Sahin, who's a colon cancer expert from Moffitt Cancer Center. Thanks so much for being here today.
It's my pleasure. Thank you.
Yeah. So tell us, what's new and exciting here at ASCO on colon cancer?
Great. So yes, it's really a great time for colorectal cancer, and it's in the move. And there are a lot of progress for precision medicine, particularly for colorectal cancer. Now we have more therapeutic targets than we had in the past, including BRAF V600E mutation, which is well known in melanoma. Now we have drugs for that, and there are studies actually combining BRAF targeting with immunotherapy, and which early signals are highly promising. And now national trials are opening in randomized fashion. So this is a very exciting time for BRAF V600E. There are trials in progress for other actionable genes. We call them actionable because these are alterations in the DNA or in genomic structure of the cancer cells that we have drug for it, and we are still investigating. And PI3K kinase is one of those actionable genes. There are nice trials that I could confidently say promising, and hopefully this is holding promise for the future. KRAS, one of the most challenging genetic alteration in the gastrointestinal field, I would say, is now one of the potential actionable alteration. KRAS 12C is on the move already. There are really promising studies, especially now being combined with EGFR blockade to achieve deeper and durable response. Now we have actually plenary session tomorrow for colorectal cancer, and I can give a heads up because I was able to access the abstract. So the left side of colon cancer and right side of colon cancer historically are biologically different, and now the study from Japan, a paradigm trial, to prove that the EGFR blockade is maybe a better approach when we use in the first line as compared to VEGF inhibition, which is bevacizumab. So, which is consistent with what we found in the past in the FIRE3 trial, which also suggested similar benefit using of the EGFR blockade, especially in the left side of colon, may have superiority in terms of length of the life the patients that we have lives. So there are really exciting things in colorectal cancer. So many other investigations, especially in immunotherapy, in the move, and colorectal cancer, one of the cold cancer that we call immune cold, because of the failure of the immune checkpoint inhibitors in MSS type of MSS colon cancer. But now we are actually being more and more smart. We are targeting certain pathways that makes the T cells inactive. We are trying to shut those pathways down and add the immunotherapy afterwards. So to create the synergistic pathways so that we can make the colorectal cancer more immune responsive. And this is a very excited time, and there's going to be a symposium. Dr. Richard Kim from Moffitt Cancer Center will be discussing, and we have an educational book chapter that's published as a Moffitt Cancer Center, and I would like you guys to read that for future of the colorectal cancer.
Well, thanks. That was a great summary that we really have to personalize colon cancer therapies, understand the molecular biology so we can use targeted therapies, combinations, immunotherapies, and now even know where the location came from, whether it's from the left side of the colon or the right side of the colon. Looks like they're different.
Yes.
So very exciting, and congratulations on all your contributions to this ASCO meeting and everything that you're doing at Moffitt Cancer Center for colon cancer patients.
It's my honor, and thank you for having me here, and it's an honor and pleasure.